Hello everyone, this is Vani.
And this is Lakshmitha.
Welcome to the MedFlix Show, your dose of real medical stories.
In just a few minutes, we'll explore one of the biggest medical challenges of our time, antimicrobial resistance.
So there's a case I recently saw.
Tell me about it.
A 62-year-old diabetic man came to the hospital with fever, chills and burning micturition for 3 days. Classic UTI symptoms, right? His doctor started him on a usual antibiotic, ciprofloxacin. But 3 days later, nothing changed. He was febrile, the burning became worse and his appetite was gone. So what went wrong? What would you have done?
I would have asked for a urine culture.
Exactly. A urine culture was finally sent. The report returned E. coli ESBL producer.
I think I have to dial this down in simple terms. Basically, this E. coli is a tiny chemical factory. It produces enzymes that break down common antibiotics like penicillins, cephalosporin, making them completely useless.
What we thought was a urinary tract infection turned out to be a case of antimicrobial resistance.
And the patient wasn't improving because he was resistant to ciprofloxacin. So, how was he treated?
He was switched to IV meropenem, a carbapenem reserved for resistant infection, which is expensive, stronger, and not the first thing anyone wants. Within 48 hours, his fever dropped, urine cleared, and his appetite returned. This isn't just one patient. Organisms like this are rising everywhere.
Why?
Because bacteria have figured ways to survive. Mutations, gene transfer, enzymes like ESBLs and efflux pumps, and human behavior pushes them to this extent. People misuse antibiotics that are over the counter, and they even stop the medications midway just because the symptom improves. But that just makes the stronger microbes survive. Poultry and livestock are also given antibiotics to grow faster, but these resistant strains enter humans through food. Why is this even a problem?
Because infections that were once easy to treat, they are becoming harder, costlier, and sometimes impossible to cure. Simple infections like UTIs, upper respiratory tract infections, viral colds, they are all at the risk of becoming deadly again. If antibiotics lose their power, modern medicine collapses because surgeries, chemotherapy, organ transplants, and ICU care, all of them are dependent on antibiotics. So how do we stop this from happening?
It starts with responsible actions. People shouldn't take antibiotics without a prescription, and they should complete the full course of medication, and they should also be aware of food sources.
By 2050, antimicrobial resistance could kill more people than cancer. That's not a prediction, but it's a warning. AMR isn't dramatic like a pandemic, but it's unfolding quietly every day. The more we understand it, the better we can protect the antibiotics that protect us. Thanks for listening. Stay informed, stay safe, and we'll meet you in the next episode.